Much too long, our mental health care delivery system has been inadequate. The accessibility and availability of treatment has been woefully limited. For a state that is rated the #1 state in the nation in which to do business, that is unacceptable.
In an effort to address Georgia's surge in overdose deaths, violence, and suicides, lawmakers today unveiled a bill to address access to care for mental health and substance abuse. House Speaker David Ralston says this needs to be a top priority for lawmakers. One major goal of House Bill 1013 is to put pressure on private insurers to improve coverage and increase state funding for treatment and crisis services.
Camila Williams explains why these improvements could help both law enforcement and people with mental illnesses.
According to the Mental Health Alliance, the state of Georgia was ranked last for mental health care. However, Georgia House Speaker David Ralston wants to improve the care and treatment these individuals face. I spoke with one mental health expert who agrees that the state should do more to help those in need of treatment and are in the hands of law enforcement.
They don't necessarily have the same level of training as a licensed clinical social worker or a professional counselor even.
River Edge Behavioral Health Director Ashley Allen explains the importance of partnering with law enforcement during a mental health crisis incident.
Whereas law enforcement, really, they get training, but not at that level.
According to a group called America's Health Ranking, low-income, rural, and Black and Hispanic communities are less likely to have access to mental health care. While Allen was not shocked that Georgia is ranked last in mental health, she's glad House Speaker David Ralston is bringing more attention.
I think it's great that they're bringing more attention to mental health challenges that people experience.
Talladega Circuit District Attorney Jonathan Adams knows all too well about the mental health court system. He said that while Georgia needs improvements, its courts are doing some things right.
That's one thing I think Georgia does right is accountability courts. We have drug courts, we have mental health courts, we have veterans courts, and I was an assistant DA in Macon for several years and headed up the district attorney's office's mental health court program.
Allen also sees room for improvement.
We need adequate mental health treatment for the entire population.
Ashley Allen says that her offices are partnered with the Bibb County Police Department to better train them on how to handle patients with a mental health crisis. Reporting in Macon, Camila Williams, 13 WMAZ News.
Lawmakers from both parties support the bill. In fact, Macon Representative James Beverly is a co-sponsor. He's a Democrat. Ralston says he also wants to provide incentives for people to get trained to be mental health workers.